The placebo effect. Why do we always use placebos in clinical research? It's because for many diseases, a certain number of patients just get better on their own, even without any treatment. Also, just seeing a doctor and being part of a study makes patients feel better. But even just the sugar pill itself can have powerful effects. In one famous study, patients were given two types of pills, blue and pink. They found that the blue pills were more calming and that the pink pills raised their level of alertness. But both pills were placebos and were chemically identical. And it's not just the color, but the form of the placebo too. Patients report greater effects from injections rather than pills, even if both are just placebos. Compare two placebos, and patients will find that the one that costs more works better. And the enthusiasm of the doctor for the placebo makes a big difference too. In one famous study, one group of hotel cleaners were told that cleaning rooms was good exercise. 4 weeks later, they lost more weight and had lower blood pressure than the group that was told nothing. It turns out that the human mind is influenced by so many factors, and it's impossible to control for them all. So we always compare new medications to placebos, because otherwise, you would never know if the patient got better because of the medication or because of the placebo effect.
The placebo effect. We'll be talking about that a lot during this semester. And a good clinical trial has an experimental group and a placebo group. I want to talk to you about two studies that I was involved in, both double-blind placebo-controlled. The VITAL study, vitamin D and omega-3 fatty acid trial, and something called galectin. It was designed for people with hypertension or high blood pressure. Let me talk about the first one. This was the vitamin D and omega-3 fatty acid study. It was nationwide. It was a double-blind placebo-controlled study. It went on for 5 years and enrolled thousands of people. So if we're looking for the characteristics that show that the results of a study can be considered more dependable, this is a design that you can count on. Oops, yes. So these are called blister packs, and they're 31 days. Anyway, I got them for each month that I was in the study. The long one, this was an omega-3 fatty acid or a placebo. This was vitamin D or placebo. And except for the last month of the study, I was a really good study subject. I took my supplements every day. I took these things with me when I went traveling. But then the last month, But anyway, when the study was over, I found out whether I was taking the placebo or the actual supplement. Let me just first say, so for over that 5-year period, the study was based out of Boston, and even though it was nationwide, living this close to Boston, I would go into Boston every summer. I would be tested, or maybe it was every other year. They took my blood, I did bone density tests, and everybody, regardless of where they lived, filled out questionnaires every 6 months. There were diet, there were symptoms, and then at the end of the 5-year period, a month after the study was over, I found out that I was taking the placebo vitamin D, but the real omega-3 fatty acid. The results of the study have shown that supplements have no effect on cholesterol levels with respect to omega-3s, the cholesterol levels, on memory function, on heart disease. And the vitamin D, while we have known for years that it's involved in bone health, did not have any of the other effects that have been associated with vitamin D, including immune function and memory as well. I think something that I talk about a lot in my nutrition class is that we're finding that it's food that can have benefits. Because when you take a vitamin D supplement, that's all you're taking is vitamin D. But when you eat foods that have vitamin D in them, you're getting the protein, you're getting other nutrients in the food that may help the body to use it more efficiently. That's why as a dietitian, unless you have a diagnosed deficiency, I'm not somebody that recommends supplements. So this was the VITAL study. And I did good in that. However, this one, not so much. So this was I don't even know, it wasn't even a phase 1 study. but it was an intervention study, so it was a double-blind placebo-controlled studies. They enrolled about 60 people at the hospital, and I was supposed to take the supplements every day. I did a lot of screening tests. They were checking for something called arteriolar elasticity. The idea was that if this supplement worked, it could reduce risk of coronary heart failure in the future. Apparently, I have a marker in my blood for heart failure. I'm not worried about it, because just because it's there doesn't mean anything's going to happen. And when you do your family tree, you'll learn what you have in your family tree, and I don't have any family history of heart failure or heart disease and a lot of cancer. So I said, sure, let me do this. I did a 5-year study, no problem. So I was screened, I was randomized, and she told me that the hardest thing about this study was actually taking the supplements. And I was like, I did it for 5 years. Well, when I opened up this bottle, oops, I don't know if you can see. I don't know how to show these to you. I was supposed to take 18 pills a day. 6 pills 3 times a day. I lasted 1 day. I'm a study failure. And see, that's important to know with studies. If you're going to be trying to get people to take something prophylactically or preventively, you got to make sure that it's something they're going to take, because if you're treating something, there may be more of a motivation to get involved. But to take something for a condition that you may or may not ever get, well, in my case, and I would call myself an N of 1, that means there's only one person that I'm looking at, I would say that my experience was not so good. So I lasted 1 day. But I get to use these as a sample to show you of a study failure, but also a study success. And that's my experience being a participant in a double-blind placebo-controlled study. That's my personal experience with being involved in clinical trials. I hope you found it interesting. If any of you have ever participated, I'd love to hear your experiences. I also worked at Boston Clinical Trials for a number of years as their research dietitian. I analyzed diets of folks who were participating in weight loss trials. These were double-blind placebo-controlled trials. So I've been on the research end of clinical trials, and I've been involved personally in clinical trials as a subject. Let's have another look at one of Jonathan's videos, which he calls the gauntlet. The double-blind placebo control is one of the last stages in research. There are a lot of steps involved in getting to the public. Right now, we may be witnessing a combination of what are called phase 2 and phase 3 trials in the development of a coronavirus vaccine.
Here's why the skeptics who shake their heads are usually right. You don't need to be a scientist to understand this. Just keep your eyes on the prize and don't lose your marbles. Each marble represents a positive scientific result, a published aha moment that looks promising. Biomedical research often starts with in vitro studies. These studies use cells grown in petri dishes and flasks being exposed to different drugs, for example. Lots of people do them, so lots of positive results are published in the scientific literature. This is interesting. Seeing how cells react to a new intervention in a petri dish is a start, but it doesn't tell us anything about the intervention's effect on tissues or organs or organisms. These promising in vitro findings have to then prove their worth in animals. Because of the limitations of the in vitro model, some of these findings don't make it. They don't translate to an animal model, but some do. Now, rats are great, but they're not human beings. So we take the findings that have held up so far, and we test them in humans in phase 1 clinical trials. Once again, some don't make it. The purpose of phase 1 trials is to assess the safety of the intervention and to report on immediate side effects. We keep going like this, losing more findings as we move from phase 1 to phase 2 human trials, where we'll test effectiveness against a placebo. And we lose some more when we go to phase 3, where we compare to standard of care. This is the finding that runs that gauntlet and makes it out alive. It was not only true for cells in a dish, but held true for animal models, then for human beings. The benefits outweighed its risks, and it did better than what we had so far. This single promising avenue is now part of common practice. Everything else was a false positive. It doesn't matter how shiny it was. It didn't work when we got closer and closer to real human beings in real life situations. This gauntlet is crucial. It should not be bypassed because it is our first line of defense against unsafe and ineffective interventions. So of course some people bypass it. If I pluck this in vitro finding and artificially put it in this container, would you use it? What are the chances that that early finding would successfully run that gauntlet? Very small. And yet that is exactly what quacks do when they take an early research finding and sell you a product based solely on that. Rogue doctors bypass the system of proofing, not at their risk, but at yours. At best, you waste your money. At worst, you experience severe side effects. If you're wondering whether or not a new treatment that has not been adopted by the medical community has potential, and the person pushing it shows you a scientific paper proving its worth, check the materials and methods section. Was this done on cells? On rats? On zebrafish? That's not enough.
Jonathan's order for his gauntlet was a little bit different than the one that we just looked at. His started with the in vitro studies, or the petri dishes. We started with animal studies. The important part to remember is that there are a lot of other studies done before we get to humans. When you see something splashing on a headline or on the news, that means that it hasn't gone through all the steps, that it has not yet been through phase 3 clinical trials. It has not been followed up, nor has it made it to publication. Things need to go through the gauntlet.